Sunday morning and time to get to work on your home. Welcome to the News Radio WHAM 1180 Home Repair Clinic, Sunday edition. Got a question, a tip, a comment? Call or text the show at 222-1180 or 1-800-295-1180. Now, live from the News Radio WHAM 1180 studios in downtown Rochester, here's Jim Salmon.
A question? A tip? Is that what he said? Good morning, everybody, and welcome to your Home Repair Clinic. Please welcome the co-host du jour of the day, Mr. John Welch. Good morning, sir.
Good morning, everyone.
How are you?
Good. How are you doing?
Good. You have a good week, did you?
Yeah, busy weekend here.
Yeah? Staying warm and all that.
Yeah. Pushing snow,
Because when it's cold out and the wind's blowing, you're miserable anyway. And if you need to have dental work done, it makes it even that worse.
That much worse.
That much worse. Please welcome to the Home Repair Clinic our favorite dentist, Dr. Paul Sussman from the Center for Cosmetic Dentistry. Good morning.
Good morning.
How are you?
It's good to be here.
Yeah.
Good.
I always like it when you come in here because, you don't often get to ask questions to a dentist that's not right in the middle of working on you. I mean, does that make sense?
It's true. That makes sense.
Yeah.
So the dentist can actually understand you in here and not.
Yeah, exactly.
It goes both ways.
Yes.
I can't ask you while you have a mouthful.
That's right. Well, first of all, thank you for keeping my mouth and my lovely wife Diane's smile going all these years. It's just been a wonderful relationship, and I was reading this article about sedation dentistry, and it had all the percentages of people that hate to go to the dentist.
Sure. Yeah.
Is that a viable thing? I mean, do you?
Well,
do
yeah,
a lot of that?
absolutely. Yeah, we do. I mean, a lot of people have had bad experiences when they were younger, and it just and
keeps going.
Yeah, it keeps going, and it keeps people away from the dentist. So we use an oral protocol where they take a pill the night before their appointment, another pill an hour before their appointment. Then we give them some more medication when they're there. And it makes them very, very relaxed. They're not totally asleep, but basically they don't really remember anything of the procedure. And
that's wonderful.
Yeah, and people have a really excellent experience. We could get a lot accomplished because they're more relaxed.
Yeah.
And also, usually, their post-op healing is actually better. I find that people that have been sedated, I usually will call them the next day, and they're doing great, and because they're more relaxed.
Right. You've met my radio partner John Carr, right?
Right, of course. Yeah.
And I told him, I said, call Doc Sussman, he'll straighten you out. We went to the dentist this past week, and they had to give him a shot or whatever, and I said, there's such an improvement in the anesthetic that you use today versus just the old Cane Sisters or whatever,
Yeah. Actually, within the past year or so, maybe a little bit more, there's a new product available that's it's called a Nutra, but it's a buffered lidocaine, and what it does, it makes the anesthetic the same acid level as your body fluids, and it's very, very comfortable. It's a lot more comfortable than traditional injections.
Right.
Most people don't even feel that I'm giving them an injection. They may feel a little pressure, but there's nothing uncomfortable.
Yeah. I remember when you did my implant, and I didn't know what that was or what was entailed in it, and it was 100% painless. I mean, the feeling of doing it was
you still
there,
know I'm
and
there,
that was a different feeling. But it was amazing. And when I a couple of years ago, or 3 or 4, or whenever it was, I fell out of a cherry tree and I broke both my legs. Now my left leg has a plate in it, and I feel it every day. I mean, some days are worse than others, and when I get up in the morning, I have to walk a certain way down the stairs to whatever. I feel it. It's not the same. With the implant, I feel no difference than what my other tooth was.
Right. Yeah, it's just like a normal, natural tooth.
Yeah.
So is that since day one, or did it take a little adjustment and you had to get used to that?
Well, it was a procedure. I mean, you do.
No, I mean not feeling it. Was that instant? You never felt
yeah,
it, or
yeah,
was
no, it wasn't. You know, after.
Yeah.
Unbelievable?
Yeah, it was pretty cool. I mean, I was amazed. I mean, the tooth that replaced was somehow split from the top down. That doesn't happen very often, does it?
Not that often, but I do see a fair number. Yeah, the tooth will split, and if it splits below the bone level, then the tooth is not restorable.
That's what happened because it would when I chew on something, it'd move around. It's just a weird feeling,
right.
you know.
Now, do you have any? I guess I can't ask you about patients, but have you ever taken anyone and just removed all of their teeth because they're destroyed and given them all new implants?
Well, yeah. I mean, that's a procedure that we do. We do quite often. I mean,
so they just they have beautiful teeth overnight.
Right. Well, it's not overnight, but and usually we don't necessarily have to. There are a number of different ways of replacing people's teeth, and what you're talking about is called implant-supported dentures. So, if they're missing all their teeth, we could maybe put like 6 implants on their upper arch and support teeth attached to that. So, they look just like natural teeth. They function just like natural teeth. And
that's a win.
And you just brush them and they last, a lifetime?
For the most part. I mean, a lifetime
if you
is
take
a long
care
time
of them.
for,
if you take
for
care
everybody.
of
them. But, yeah, I mean, they're more of a lifetime restoration. Teeth can decay. In many ways, implants are better than your natural teeth.
Right.
If your teeth are compromised.
Yeah, I asked him when I was in the office. I said, "Can I still chew on ice cubes?" Because I like to chew. And he goes, "Well, it's never going to hurt the implant, but your regular teeth, you probably shouldn't do that."
Yeah.
Right. Implants are made of titanium. So they're much more resistant to any type of dental problem than your natural teeth. I mean, on top of the implant, we put the porcelain crown. So the porcelain can become damaged if you chew on ice cubes.
If you break it,
But
right,
those
right.
are readily replaceable.
Yeah,
if you do
exactly.
something.
And it's not a big deal to repair that.
Right.
What always amazed me is, and I have, 2 or 3 crowns from you and an implant and a bunch of other stuff, but nothing ever comes apart. The adhesive you use must be some kind of super.
Could we get that in the building department?
Yeah, I mean, yeah, exactly. I mean, when you put on a crown, it stays there.
Yeah, I mean there have been lots of improvements over the years with the adhesive technology because things are bonded, and now it used to be they were cemented, but now they're actually chemically bonded to your tooth, so the strength is much greater.
It's funny. We talked about like if I'm looking at someone's landscape, I'm dissecting it in my brain when I pull up to a house or whatever. I'm dissecting it. And Dr. Sussman, I feel like I got to keep my mouth closed. He's dissecting my teeth.
Well,
he's like, I could do this with that one. I could do this with that one.
This time of year, though, people make New Year's resolutions, and if you're not happy with your
That's
smile,
it. Tune them up.
Yeah, I mean,
yeah, we get quite a few people come in. They want to improve their smile, and you say that I dissect your smile, but people's overall impressions when somebody meets somebody is really their smile
matters.
Whether
matters.
it's a conscious that effort that they're looking at it, or just an overall feeling that you get about somebody. When they have a nice smile, they have you get a much better first impression.
Yeah, it improves your confidence level too.
Smile. Let me check your teeth here.
See those?
We're visiting with Dr. Sussman this morning. He's my personal dentist, and he has a dental office in the Grease Ridge Mall. It's still called that, right?
Yeah.
Grease Ridge Mall. And the phone number is 22-SMILE. Give him a call, schedule an appointment. We're going to take a quick break, a couple appearances by the art players, and we'll come back and visit with Dr. Sussman from the Center for Cosmetic Dentistry. Some more. Everybody, and welcome back to your home repair clinic. A little Israel there, and he was one of Hawaii's heaviest people, wonderful singer, and in light of what went on in Hawaii, I figured we'd have
I just heard on the radio on the way in they had some fake alarm or something like that.
Yeah, a missile.
That's scary.
Everybody on the island got a text saying a missile is inbound. This is not a drill. But can you imagine that? Oh my gosh.
So anyway, Nikki said someone called in about something, and we should kick that answer out.
We were just talking about implants and how long it takes to do that, because there's a lot of advertising out there. I mean, the ideal way of doing that is what?
Well, it really depends on what the patient's coming in with. A lot of times people will be coming in with teeth that are broken down and they may have infections. So we have to clear up those infections, and that can be by removing the teeth. So there are a number of different ways of replacing those teeth. Sometimes we can put the implants in the same time we take the teeth out and put a false tooth to replace that. Sometimes it can be done all in at one time.
Right.
Other times we need to wait for the body to heal. So for the implants have to integrate into the bone, and then we could restore them.
That's the ideal condition. You have to be patient sometimes.
Yeah,
okay.
Most often there is some period of healing, because what will make an implant fail is movement. And if you're putting something on that implant and then you're chewing on that and it's going to cause movement, then that implant is not going to integrate into the bone.
I get it.
And you could end up losing that implant.
And the bone actually grows around this thing, right?
It integrates, becomes part of the bone.
To me, it looked like a little teeny thimble.
Yeah, it's like a screw, basically, made of titanium.
And he has this little teeny ratchet that I won't give it. Let's
same tools I have, just for much more delicate work.
Yeah, and probably 50 times more expensive.
Right.
Yeah, and in answer to the question that we do implant-supported dentures. That's a fair amount of the treatment that I do.
That you do.
Yeah.
Okay. Let's bring Greg in here. He has a question about crown repair. Good morning, Greg.
Yes. Hi. Good morning. I have a question about crowns regarding. I got older crowns, about half a dozen that are falling apart, and the dentist wants to replace them. We're replacing them just about every year, $1,200 a piece. Wonder if there's an alternative, or is really the adhesive that much better when I can hope for it'll last longer?
Well, it really depends on the reason they need to be replaced. With crowns, decay could form at the junction between the crown and the tooth surface. So if that's the case, then the seal that crown is supposed to have has been compromised. So really the only way to take care of that is to replace the crown. If it's just the crown became loose and the underlying tooth structure is good, then usually they can be re-cemented.
How do you get a crown off if it's glued in place? Does it come off in?
Well, we do have something called a crown remover that sometimes will work, but very often we have to drill it off. We have to
and so you're doing a new crown then? Okay.
Yeah.
Right. Yeah, and unfortunately, anything worth having in life has a certain cost to it.
Yeah, and with the human body, unfortunately, things do wear out.
Yeah.
Okay, so the root implant or the implant is not an alternative.
Well, it can be if the tooth is compromised enough. Then an implant might be a good alternative. But I don't like to take teeth out if the root structure is still good. Your own tooth is still really the best thing. Okay,
because I keep hearing root canal whenever I go in there. It worries me.
Been down that road myself.
Yeah. I mean,
join the club.
If a tooth needs a root canal, if the remaining tooth structure is compromised, then an implant might be something to consider, because very often with the life cycle of a tooth, you may get a filling, and then that filling has to be replaced, and then the nerve becomes damaged, so it needs a root canal, and it may eventually, wear out, whereas that an implant can replace that. So
and it's permanent.
Yeah.
Okay, excellent. Thank you very much.
All right, Greg, thanks. Good question there, buddy. Thanks for calling in. We appreciate it.
Do you do the day-to-day dental work at the office, too, like the
absolutely.
cleanings and the all that?
Yeah, definitely.
Right.
Yeah, well, I practice with my wife, and so we do all phases of general dentistry.
Yeah, okay.
My dental hygienist is Paula,
Right.
and she's she's been doing this for a while. This isn't her first rodeo, and I worked over a little bit when I get in there, but it's.
But you deserve it.
When I come out of there, though, I have the freshest, best
Breath.
My teeth were never cleaned properly, and then you did this deep root cleaning thing,
Right.
which I can't tell you how different that was, and how much better the whole experience was after that.
Well, bacteria accumulates under the gums, and that's what causes gum disease and bone loss. So it's important to get underneath the gums to remove that bacteria, and it's referred to now as a biofilm. It's actually like a sticky layer that adheres to the root surface of the tooth. So by going in there and disrupting that biofilm and getting rid of the bacteria, your gums are allowed to heal, and everything stays healthier.
Works for me.
This is fascinating.
We're visiting this morning with Dr. Paul Sussman from the Center for Cosmetic Dentistry in the Grease Ridge Mall. Dr. Sussman and Dr. Pogel. 22-SMILE is the phone number, 22-SMILE. Or you can just stop by, and Lorraine's right there at the
Right.
desk all the time. She
Give
can
you
make you an appointment.
Right.
And when you walk in there, you turn to the right, and there's a picture on the wall of my lovely wife, Diane, and her beautiful smile.
Yeah, she's beautiful.
I have a million other things, so let's have you back again, okay?
Sure, I love that.
Thanks for coming in. Dr. Paul Sussman, 22-SMILE. We'll be back after the news.